Diphtheria. Diphtheria is an acute and highly contagious bacterial infection that primarily affects the respiratory system. It can also affect other parts of the body, such as the skin, eyes, and genitals. Diphtheria is caused by the bacterium Corynebacterium diphtheria. It releases a toxin that can cause severe damage to tissues and organs. Here, we will provide a detailed account of diphtheria, including its symptoms, causes, diagnosis, treatment, and prevention. Diphtheria mainly affects the throat and upper airways, and can cause a thick gray coating on the tonsils, throat, and nasal passages. There are two types of diphtheria: cutaneous, skin, diphtheria and respiratory diphtheria. Cutaneous diphtheria is an infection of the skin, usually caused by contact with an infected person or animal. Symptoms include fever, redness, pain, and swelling of the skin. Respiratory diphtheria is an infection of the throat and upper airways, and is the most common and serious form of diphtheria. Symptoms include fever, sore throat, difficulty swallowing, and a barking cough. Diphtheria has been reported as an epidemic in various parts of the world throughout history. One of the most well-known diphtheria epidemics occurred in the late 19th century and early 20th century in Europe and North America. This epidemic was particularly severe in urban areas, where overcrowding and poor sanitation contributed to the spread of the disease. One of the most infamous diphtheria epidemics occurred in Nome, Alaska, in 1925. A diphtheria outbreak threatened the town and the only available serum was in Anchorage, over 600 miles away. A relay of dog sled teams transported the serum to Nome, a feat now known as the Iditarod Trail Sled Dog Race. Today, diphtheria is still a serious health concern in many parts of the world, particularly in areas with poor vaccination coverage and limited access to healthcare. In recent years, diphtheria epidemics have been reported in countries such as Yemen, Bangladesh, and Indonesia. In order to control and prevent diphtheria outbreaks, it is important to maintain high vaccination coverage rates and to quickly identify and treat cases of the disease. Diphtheria typically starts with a sore throat, mild fever, and swollen glands in the neck. As the disease progresses, a thick, grayish-white coating develops in the throat or nose, which can make it difficult to breathe or swallow. Other symptoms may include coughing, difficulty breathing, bluish skin, rapid heartbeat, nerve, kidney or heart problems, if the bacteria enters your bloodstream, and fever. Diphtheria is caused by the bacterium Corynebacterium diphtheriae. The bacterium is spread from person to person through respiratory droplets, such as those produced when an infected person coughs or sneezes. It can also be spread through contact with contaminated surfaces or objects, such as toys, clothing, or bedding. Is diphtheria contagious? Yes, diphtheria is highly contagious and can easily spread from person to person. The bacteria that cause diphtheria, Corynebacterium diphtheriae, are typically spread through respiratory droplets, such as those produced when an infected person coughs or sneezes. The bacteria can also be spread through contact with contaminated objects or surfaces. Diphtheria is most contagious during the first 2 weeks of illness. But an infected person can continue to spread the bacteria for up to 4 weeks after symptoms begin, even if they are no longer experiencing symptoms themselves. Because diphtheria is so contagious, it is important to take precautions to prevent its spread. This includes frequent hand washing, covering the mouth and nose when coughing or sneezing, avoiding contact with infected individuals, and staying up to date on vaccinations. What are the complications associated with diphtheria? Diphtheria can cause a variety of complications, some of which can be severe or even life-threatening. Here are some of the complications that can occur with diphtheria. Difficulty breathing. The toxin produced by the bacteria can cause the airways to become inflamed and narrow, making it difficult to breathe. Heart damage. The toxin can also damage the heart muscle, leading to an irregular heartbeat or even heart failure. Nerve damage. In severe cases, the toxin can damage the nerves, causing paralysis or other neurological problems. Kidney failure. The toxin can damage the kidneys, leading to kidney failure. Skin infections. Diphtheria can also cause skin infections, particularly in areas where the bacteria have entered through a cut or wound. Pneumonia. In some cases, diphtheria can lead to pneumonia, which is an infection of the lungs. Death. Although rare, diphtheria can be fatal, particularly in young children or older adults who may be more vulnerable to complications. It's important to note that with prompt and appropriate treatment, most people with diphtheria will make a full recovery without experiencing any complications. However, it's also important to take steps to prevent the spread of the disease, such as vaccination and good hygiene practices. How long does diphtheria last? The duration of diphtheria can vary depending on a number of factors, including the severity of the infection and how quickly it is diagnosed and treated. In general, the acute phase of the illness typically lasts for 1 to 2 weeks, during which time the bacteria are actively replicating in the body and producing toxins. During this time, symptoms such as fever, sore throat, and fatigue may be present, as well as the characteristic grayish-white membrane on the back of the throat. If left untreated, the disease can progress and lead to complications such as difficulty breathing, heart damage, and nerve damage. Recovery. After the acute phase, most people with diphtheria will begin to recover, although it may take several weeks or even months to fully regain their strength and energy. In some cases, however, complications may persist or new complications may develop even after the acute phase has ended. In order to minimize the risk of complications and ensure a full recovery, it is important to seek prompt medical attention if you suspect that you or someone else may have diphtheria. Treatment typically involves antibiotics to eliminate the bacteria, as well as supportive care to manage symptoms and prevent complications. Just because the back of my throat is gray, does it mean I have diphtheria? Not necessarily. While a grayish-white membrane on the back of the throat is a classic symptom of diphtheria, it can also be caused by other conditions such as strep throat, tonsillitis, or a viral infection. It is important to see a healthcare provider for an accurate diagnosis, as prompt treatment can be critical in preventing complications and minimizing the spread of disease. If you are experiencing symptoms such as a sore throat, fever, fatigue, or difficulty swallowing, it is important to seek medical attention as soon as possible. Your healthcare provider may perform a physical examination and order diagnostic tests such as a throat culture or blood test to determine the cause of your symptoms. If diphtheria is suspected, additional testing may be needed to confirm the diagnosis and assess the severity of the infection. Remember that prevention is always better than treatment, so it's important to stay up to date on recommended vaccinations and practice good hygiene habits such as frequent hand washing to minimize the risk of contracting or spreading diphtheria or other infectious diseases. Diagnosis. Diphtheria is diagnosed based on a combination of symptoms, medical history, and laboratory tests. A throat culture or nasal swab can confirm the presence of the bacterium, while a blood test can detect the toxin produced by the bacterium. Diphtheria is treated with antibiotics, such as penicillin or erythromycin, to kill the bacterium. In addition, patients may need to receive antitoxin, which is a substance that can neutralize the toxin produced by the bacterium. Patients with severe cases of diphtheria may need to be hospitalized and may require support to help them breathe. What is the immunization schedule for diphtheria? The recommended immunization schedule for diphtheria can vary depending on the country and region, as well as on individual factors such as age, health status, and vaccination history. In general, however, the following guidelines are commonly followed. Infants and children. The diphtheria vaccine is typically given as part of a combination vaccine that also protects against tetanus and pertussis, whooping cough. The vaccine is usually given in a series of 5 doses, starting at 2 months of age, and continuing at 4 months, 6 months, 15 to 18 months, and 4 to 6 years of age. Adolescents and adults. Adolescents and adults who have not been fully vaccinated against diphtheria should receive a booster dose of the vaccine, typically at age 11 to 12 years. A second booster is recommended at age 16 to 18 years. After the initial series of vaccinations, adults should receive a booster dose every 10 years. It's important to note that vaccination is the most effective way to prevent diphtheria, as well as tetanus and pertussis. By following the recommended immunization schedule, individuals can reduce their risk of contracting and spreading these diseases, as well as protect vulnerable populations such as infants, older adults, and those with weakened immune systems. The most effective way to prevent diphtheria is through vaccination. The diphtheria vaccine is typically given in combination with vaccines for tetanus and pertussis, whooping cough, and is recommended for all children starting at 2 months of age. Booster shots are recommended every 10 years for adults. Other preventive measures include good hygiene, such as frequent hand washing, covering the mouth and nose when coughing or sneezing, and avoiding contact with infected individuals. In conclusion, diphtheria is a serious bacterial infection that can cause severe damage to tissues and organs. It is highly contagious and can be life-threatening, especially for young children and older adults. However, with early diagnosis and treatment, most patients can make a full recovery. The best way to prevent diphtheria is through vaccination and good hygiene practices.